Very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to learn one more important remedy from third year syllabus as well as very important from practice point of view. And that is Syphilinum. Syphilinum is a nosode and which is very useful whenever you have a pathological cases or syphilitic cases. Before going to the Alensky notes, we're going to learn some clinical cases in which I have used this Syphilinum. I want to share one important case of a paralytic ileus. In fact, it is Hirschsprung disease where I have utilized Syphilinum. It was a child who was operated for the Hirschsprung disease. 3 times the surgery was done, but every time he had that paralytic part of ileus over there, and he was not having. Every time he has to go for uh, enema, and with enema only he used to pass the stools. It is Hirschsprung disease. Hirschsprung. Spelling is Hirschprung, but it is pronunciation is Hirschsprung. So it is Hirschsprung disease. It is a paralytic ileus. Generally happens to be there at the birth only, many times. So I have that case. The child had few important things. There was big gap in the teeth. Second important thing was that there is a bossing forehead was there. The nose was depressed going inside. So typical syphilitic features which were characteristically present over there on his faces. And he had that obstinate constipation. Without enema, he never used to pass the stools and it was continuous. He was nearly about 5, 6 years old, but the enema was going on, and because of which he used to pass the stools, otherwise not at all. And they have done a lot of treatment, went from one gastroenterologist to other, then surgeons and everyone, and operated, but without any result. So syphilitic constitution with obstinate constipation, with continuous use of enema, gaps in teeth, the frontal bossing, the depressed nose, a typical faces of the syphilitic personalities. I used to think about the syphilinum. So on day one only, I have started directly with the Syphilinum 1M, and I have given 3 doses on day one, 3 doses of Syphilinum 1M next day, and waited for the result. I have given along with him the biocombination 4, but I was damn sure that this is the syphilitic personality, syphilitic problem. So let us see what happens in this case, whether the patient's relatives, they are able to stop the enema or things, etc. Ask them that don't do enema daily, you do it on alternate days. And if he passes stools, then you stop and take one more day. So on day one, day two, whenever Syphilinum was given, on third day, they never done the enema. And even though child has passed the stools, it was good for them. First time the child has passed stools without enema. Then again, after 2 more days, they stopped giving the enema again for 2 days gap, and the child started passing the stools. After 10 days afterwards, the enema was not required for consecutively 5 days, and child was brought to me after 15 days. And when I heard the peristalsis, there was good peristalsis in the abdomen for all 4 quadrants. So this is a very important remedy in paralytic ileus or Hirschsprung disease. One must think whenever the they are of a syphilitic constitution or having a syphilitic dyscrasia. Second important thing in which I have used this remedy is for the alcoholism. There was a case of dipsomania, day and night continuously drinking, and he had a very severe addiction. It was there right from it in the histories. It was there from grandparents, parents, everyone, and that's why he also got addicted to it, and he had that syphilitic tendency. Dipsomania itself is a syphilitic entity. Unnatural craving for alcohol is syphilitic tendency. And this fellow, if he don't drink, he used to suffer from severe headache. And that's why he used to take the alcohol and then he feels better. And headache was very typical characteristic. It used to start in the evening. It remains late at night and then at the daybreak it used to stop. And it is a very, very, very severe character. It is a migrainal headache. So it never used to get settled with that. So that is very typical modality of syphilitic miasm. Day night, daytime they feels better. From evening to morning they get aggravated. Then headache, which is of throbbing character, neuralgic character, very severe. All those things which were present, and along with a dipsomania. So I was damn sure this is syphilinum. So I started him giving a syphilinum. In this case, I have started with 200 and later on increased to 1 m and 10 m. But it worked so beautifully that his headache stopped. After headache, after migraine has stopped, the craving for alcohol also deteriorated, or it is also decreased. So this was a wonderful result which I have seen in dipsomanic migrainal headache. That patient has recovered very nicely with the help of syphilinum. Here, this nosode you can use from 200 to higher potencies. Some for few doses you can repeat, but don't repeat forever. Being a nosode, you should be very cautious in using, but you can give it for a day or two, and you can repeat that in that way. Open your Allen's notes and let us see the syphilinum. Syphilinum, it is syphilitic virus. This remedy has been proved by 5 different provers. Samuel Swan, he was the first one, then Skinner Thomas, then E.B. Nash, then H.C. Allen, then J.T. Kent, the 5 people who have uh, proved this remedy. Pains from darkness to daylight. This is very, very characteristic of syphilitic miasm and syphilinum. Pains begins with twilight and ends with daylight. Mercurius, Phytolacca. These are the remedies. Syphilitic miasm used to have same feature. Pains increase and decrease gradually, like sternum metallicum, like platina. This is one more feature. Shifting and require frequent change of position. All symptoms are worse at night, murk, from sundown to sunrise. Eruptions, which are dull, red, copper colored spots, becoming blue on getting the cold. So, eruptions which are characteristic copper colored spots, becoming blue on getting the cold. So, if they if the cold is applied or if there is a cold weather, it becomes blue. Extreme emaciation of the whole body, like abrotenum, like iodum, increased metabolic rate, which is there. Hurt features are very characteristic over here. There are lancinating pains from the base to the apex, specifically at night. If it is from apex to base, then it is medorinum. From base to the clavicle or shoulder, then it is pygelia. Here, it is from base to the apex. Very clear-cut indication which has been mentioned. Loss of memory. Cannot remember names of books, persons, places. Arithmetical calculations are difficult. So mathematics, they are quite difficult for syphilitic personalities, syphilitic syphilinum, and they forget the names, they forget the names of the person, they forget the places, even streets, name of the specific streets. Sensation as if going insane, as if about to be paralyzed. So they feel that they will going to get paralyzed. They will feel that they will going to get mad. Apathy and indifference. That is one more feature. They started talking less and they becomes indifferent. That is the last phase where mental deterioration happens over there. Terrible dead of night on account of mental and physical exhaustion on awakening. It is intolerable. The death is preferable. So at night, all complaints gets aggravated, whether they are physical, whether they are mental. The people, they are very, very frustrated. As the night approaches, they becomes frightful. They feel that it is better to die than to remain alive at night. So much terrible problems are there at night. Fears the terrific suffering from exhaustion on awakening, like lachesis. After lachesis slips into aggravation. Similarly, in syphilinum, you get similar type of feature over there. Leucorrhea, which is profuse, soaking through the napkins and running down to the heels. It is profuse leucorrhea. The discharge is passing and it runs through the thighs, through the napkins up to the thighs, up to the legs, like alumina. Alumina is also having similar type of feature. So that is one more feature with the syphilinum. Headache is characteristic. This is very important remedy for migraine, which is not getting settled. Headache, neuralgic in character, causing sleeplessness and delirium at night. It commences at 4 p.m., worse from 10 to 11, and ceasing at daylight. Ceases at 11 to 12 p.m. is lycopodium. So lycopodium, it starts at 4 p.m. and it ends with 10 to 11 to 12 p.m. It is lycopodium. Falling of hair. Syphilinum has a typical alopecia areata, alopecia totalis. This is very important feature which you can think about in this case. Acute ophthalmia neonatal. Lids are swollen, adhere during sleep, pains intense at night. So ophthalmia neonatal, when lids are swollen, they are adheres during the sleep and pains are aggravated, specifically at night, aggravated from 2 to 5 a.m. There is profuse pus ameliorated by cold bathing. Ptosis, it is again neuropathy. Ptosis is drooping of the lids. So ptosis, it is a paralysis of the superior oblique muscle, very typically mentioned over there. Sleepy look from drooping of lids. The lids are droop like this and they are not able to open up very clearly. It happens generally. I have used this remedy in one case of myasthenia gravis also. Along with causticum has produced certain result and thereafter no more recovery. I have given intercurrent as a syphilinum and it works so beautifully in thereafter causticum work. So ptosis, paralysis of superior oblique, sleepy look from drooping lids, causticum and graphitis, diplopia, one image seen below the other. And this happens because of ptosis. Many times this happens. So in myasthenia cases, this drooping of eyelids is very common and they get the diplopia. Teeth, they are decay at age of the gums and breaks off. Teeth are cupped, edges serrated, the dwarf in size, converge at their tips, like staphysagrine. So caries of teeth, this is one important remedy and it is open, that is at the edges you get this caries. Craving for alcohol in any form. This is very important remedy. Craving for alcohol any form. Hereditary tendency to alcoholism. Asaram, soranum, tuberculinum, sulfur, sulfuric acid. But this remedy is very important when hereditary tendency is more marked. Obstinate constipation for years. Rectum seems tied up with strictures. When enema was used, the agony of passage was like a labor. So very difficult, even enema is painful, lac caninum, Then tuberculum, these are two remedies which are mentioned over there. Just now I shared case of herpes. Fissures in anus and rectum, like thuja. Prolapse or rectum, obstinate cases of syphilitic history. Rheumatism of shoulder joint. This is again one more feature where I used the Syphilinum. Rheumatism of shoulder joint, specifically it is the frozen shoulder or at the insertion of deltoid. So deltoid rheumatism. Aggravated from raising arm laterally like crustox. Then right shoulder it is sanguinaria, left shoulder it is perum metallicum. So rheumatism of left shoulder, perum met, rheumatism right shoulder, it is the sanguinaria canadensis. When the best selected remedy fails to relieve and or permanently improve, in specifically in syphilitic affections, then always think of giving syphilinum as an intercurrent remedy. Syphilitics are patients who have had chancre treated with by local means and as a result have suffered from throat and skin troubles for years are nearly always benefited by this remedy at the commencement of treatment unless some other remedy is clearly indicated. So this is very important remedy whenever the suppressed chancre is there or suppressed syphilis is there. This one should not forget. Relations compare aurum, asafoetida, the kali iodatum, the mercurius, the phytolacca in bone diseases and syphilitic affections. So all remedies which are syphilitic, specifically acting on bones, acting on specifically having a syphilitic tendencies are these remedies. Aggravation at night from twilight to daylight. Generally, this remedy should be used at in 200 or more potencies. Repetition 1 or 2 days, not more than that. And this remedy as an intercurrent always helps a lot. So one must go through the Syphilinum again to learn the depth of Syphilinum from different books. You are going to find it out many things about the Syphilinum. So that's all for today. Thank you being there. Tomorrow we'll continue with the next remedy.
Hello, sir.
Yes.
Sir, in case of alopecia, when we treated that patient with some other remedy, since means phosphoric acid असेल किंवा auromet असेल किंवा काय, and when no improvement is there, then can we prescribe Syphilinum, sir?
Yeah, if the patient's miasm is syphilitic, definitely.
Yes.
Definitely you can use. As an intercurrent, it is wonderful remedy.
And how much is dose, sir?
No, 1 m.
30?
You if when
1
you are using it in as an intercurrent, give 1 m, 3 doses. That's all. Don't repeat.
Okay. Okay. Thank you, sir.
Okay. So good night,
Thank you,
and
sir.
we'll meet tomorrow.